And from Breakthrough One over to the chair of the Breakthrough Alliance, Bill Taranto. Sir, I am going to give the mic over to you to speak with Anuradhika from Common Spirit Health.
Thank you. Thank you, Jerry. Appreciate it very much. And welcome, everybody. I always look forward to doing these each month. And today I get to talk to Anu, who's System Vice President at Common Spirit. So I got a lot of good questions for her today and want to learn about more, though I've met her, have the audience learn about her a little more and what Common Spirit does. So Anu, I'll ask you to unmute. There you go. Perfect. Welcome. Great to see you. So Anu, we have a really vast audience and a lot of them may not know you, but we want to hear about your career journey, you know, where you started, and then how did you end up at Common Spirit Health as System Vice President, Strategic Partnerships? We'd love to hear your journey.
Sure. And hello, Bill, and a good day to all the HIT community tuning across the time zones. Also wishes for safety for anyone who's joining from Florida, if you're able to. So Bill, you asked about my journey. Well, I was born in India. Now, don't we hate when someone goes that far back? But don't worry, the only relevance of that here is to share that I'm a first-generation immigrant in this beautiful country and remain extremely grateful to the village of teachers, mentors, guides, who instilled in me actually two things that you'll hear, which, you know, really shepherding the journey I went on. So one was the innate repulsion from getting too comfortable with one career or one trajectory. And the second was to never lose my curiosity. But doing so, they led me to start a career in clinical research. So I am a trained pharmacist, but then I pivoted to a career in healthcare administration where I got a chance, or the privilege actually, to lead physician and nursing teams, to an early stage startup where I had an opportunity to manage partnerships, analytics, to innovation, and eventually ventures now for one of the largest not-for-profit healthcare systems in the country. Now, the one common professional goal across all these career paths has been to continue to gain a deep appreciation for the work, the connectivity, and complexity of healthcare. So from the perseverance of our healthcare workers, which I'm sure you all witnessed and got a chance to experience during the COVID or got a chance to read, to the creativity of the present-day founders and entrepreneurs. Having walked a mile in someone's shoes, I think does give you a very different regard. And that has been the goal across these journeys, to have that regard and have that appreciation and bring it forth to all I do. And on a much personal level, I think it has been probably a continuous reminder of the trifecta that I think a lot of people in the audience may agree with, or have had a chance to shape the trajectory of their journey. The notion of working hard, staying humble, but most importantly, paying it forward at every opportunity. So that's a little bit of, Bill, where I started and how I ended up doing what I'm doing today.
Well, thank you for that. That's great to hear. So my next, it's kind of a two-part question, but I figure you'll answer them all in the same sort of question is, you know, one, what actually do you do as System Vice President at Common Spirit? And then I want to understand also a little bit about Common Spirit Health and what their mission is, what their vision is, and what they're doing, and then how does that tie into what you actually then do for a living for them?
Absolutely. So for those of you who may not be familiar, Common Spirit Health is the parent entity, which was formed as a result of merger of CHI Health Systems and Dignity Health in 2019. That merger made us one of the largest healthcare systems in the country. So we are 150,000 employees strong, the largest provider of Medicare in the country, and now have the privilege to serve patients across 21 states. So our communities, our patients are as diverse as our providers and the communities we serve. So in my current role today, I split my time between the innovation function and the Common Spirit Ventures, which is the investment arm for Common Spirit Health. Both of them have a shared focus to work on initiatives that have the greatest potential to improve outcomes, patient experience, and equity. And that is actually what the mission for the organization is too. We say we lead with human kindness. And human kindness, as you can imagine, is representative of the access to care, equity to care, and ensuring that both our providers and patients are really feeling that in their experience when dealing with us. Now, Bill, I think this community probably knows the best that innovation can mean many different things to many different folks, depending on who you're asking. But for us, it's an acute realization that healthcare is constantly evolving. And we choose to be a part of it, to be a part of that evolution, to have a voice in that evolution, rather than being a mere bystander to that happening. we recognize that as healthcare systems, we do something really well and others not so much. So there is a constant need for digital care models that can lower the cost of care, provide more convenient, personalized experience and touch points for our patients. But similarly, there's much room to support our providers and caregivers. So for us, innovation is taking on collaborative approaches that reach beyond the traditional auspices of like healthcare delivery or healthcare systems to find solutions that can actually address these problems from the very core. So in both our investment and our innovation efforts, we keep our thesis really simple. We say we do well financially by doing the right thing from the community. So that continues to be our North Star. Everything else follows if you have the right goal and the right North Star. And so that's been our journey on the innovation and the investment side.
Great. I'd like to ask a follow-on question, because this is obviously, you and I have some in common, as myself being an investor. And I'd just like to hear a little bit more about how you think about investing, sort of maybe a little bit more what stage you might look at, and maybe one example of something that you've recently invested in that you could share with the audience.
Absolutely. So I know that healthcare systems jumping into investment is becoming a lot of norm there. And so I always start by reminding the audience that we were some of the first healthcare systems to do that. So we've been doing this almost for 10 plus years. So it's not the latest, nudge to keep up with the market. This has been a very core, and I think the foundational of this is to understand and recognize that creativity and problem solving can come from all sides, and we should play to our strengths. So I do not have a team of engineers who can go deep and bring tech solutions, nor do we need to have one as a healthcare system. Our strength is to really make sure that we are very close to the patient and we know what their patient needs are, and then we can collaborate with others. So our investment approach is also firmly rooted in operations first. And what it means is that we want to welcome companies that are doing some transformative work out there and need a proof of concept to our ecosystem. As I shared, we're across 21 states, which means we have very diverse range of patients and providers in our community. And so sometimes matching up the right company to the right patient and the community so that they can test out their ideas is the first entry point of them into our ecosystem. And from there, if the idea is successful and the pilots are successful, it can lead to broader adoption across the ecosystem. So for us, having an operational partnership with the company that we go invest in is the paramount difference that sort of differentiates us from other healthcare systems. So it's operations first approach. And then coming to the cap table, we generally come in as a co-investment partner, which means strategic for some of you who are familiar with the terminology. So we let the firms who are doing this inside and out do their job. We let the VCs be the lead. And then we come in as a strategic to make sure that we are adding value from the lens of a healthcare system, from a lens of a provider. And in doing so can really help the entrepreneur and the founder get the best of the both worlds in terms of the support they need to evolve an idea from its inception to where it can have a significant impact. So referring to some of the latest ones we've had, Bill, I would say Concert Health was the last investment that we came in. I think that was almost 3 months ago now. Concert Health is a behavioral health company. And for those of you who may not be familiar, you should go check out. They're doing some tremendous work in collaborative care models. So, behavioral health is an acute need. It was even made more visible during the pandemic that we have huge gaps in how we are serving the needs of our community for behavioral health. So for us, Concert Health became our partner almost like 3 years ago when they were trying to launch the collaborative care model that is embedded in primary care. It really resonated with our providers because it allows them to stay connected, but at the same time allows them to pull in experts from the behavioral health space to provide care to the patients. So we became their operational partners, really testing out the ideas. It's a phenomenal leadership that drives the company. And so when the timing came for them to raise their next round, we absolutely had the privilege and the opportunity to be a part of it, and we chose to do so. And now we are trying to make sure that Concert Health has a more stronger behavioral health presence, not only within our ecosystem, but in industry at large, because their impact and results are phenomenal. I mean, the patients who are leveraging them, I was reading the stats just a few days ago that 75% of them had never had access to any sort sort of behavioral health care before that. So when you start thinking about what it does to the access of the patients for something as acute as behavioral health, I think it really puts things in perspective. So yeah, investment thesis is to have operational partnerships first, and then to go all in with the founder to ensure that they have a chance to evolve and adopt the area across a bigger ecosystem.
Well, thank you for that answer, and hopefully we can co-invest together at some point.
Sure.
To my next question, you got into a little bit in your answer around potentially when equity is involved, how someone can engage with you, but for our broader audience, how can they potentially, if it's maybe not always about an equity sort of component, how can they maybe engage with you either through their company that they have or whatever position that they have? How do they engage with your office as well as Common Spirit?
Absolutely. And I would say before I answer that, I would want to take a moment to congratulate Dr. Stan, who I know is not here today, but Jerry and many of others who realized the need and came together to build this community. Because at the end of the day, digital health and innovation are constantly evolving. So there has to be this back and forth between people who are developing the solutions and users like us who know that things can be done better and there's a need for transformation. And so communities like this bring both the sides together. And so that's really, really exciting to see. And the more advocates that we can get, I think we can better lift each other up. So huge kudos to the HIT community for doing so. And then to your question, Bill, on how can people reach out to us? I think my hope from communities like this is that they can continue to ensure that representation is embedded at each level. So when I am looking at the market and I'm looking at the solutions, I'm really tuned into, are the solutions representative of the communities they wish to serve, right? If you looked at the clinical trials data and you look at the underrepresentation of women in some of them and the underrepresentation of people of color, and now with the AI solutions coming, I think the next wave is getting much better. So it gives me a lot of hope. But early in our days, when we were talking with the AI companies, and one question we'll always ask is, who is your demographic sample set here? It wasn't as diverse. And so you end up entering into this vicious circle where the solutions that are being developed are not representative of the communities they serve. So for us, it's really, really important. So I would say for anyone in the community who's trying to build something and just wants to idea test or, think aloud with us or ensure that they have a way to get their representation, we're always game to connect, inform, support, give my 2 cents. So please do reach out. But more importantly, as you're building those solutions, let's stay very cognizant of the fact that patients in California and Arizona are very different from some of our rural populations in Tennessee and Kentucky. We also know and have learned that patient access to technology is very different. It became very obvious when we started rolling out a lot of our remote patient monitoring techniques. And so the health literacy also varies. So we're very mindful as you develop the solutions. And if you have questions and if you're curious whether that will work or not work, we're always eager to brainstorm together and give our 2 cents. So please do reach out. And then essentially have this community be the one where, there could be a bi-directional dialogue on what you're creating and how its applicability may be within a big healthcare system or an ecosystem that's as diverse as us. So let's use this way to inform each other's work, support each other, and also to hold each other accountable to a certain extent that we are pivoting the path for digital health in the right manner and the right intent.
Okay, well, thank you. We probably have time for one more question because we started a couple minutes after 1 and we get 15 minutes here. And I think you might have an interesting perspective on this question is, where do you see digital health going? Is this a replacement for traditional healthcare? Is this an enhancement? And I'm just curious, you being in a health system, you might have an interesting perspective on it. Just where is digital health going in the future?
Yeah, and I think Dr. Bhatt, who was speaking prior to me, made some really amazing points. I found myself clapping on so many of them as to where can digital tech evolve and where it's headed. I would say that I'm a firm believer that technology brought a lot of efficiency and did replace the old way of doing things. And so that was the first stage, right? So the amount of reach it added in certain areas was huge, so paramount. So definitely a believer that digital tech and digital health has a huge huge role in like shaping the future of healthcare system. But I would also say, sitting from my healthcare perspective, that the service component can sometimes be under represented or ignored when the tech solutions are being developed. And therefore, it can result in segregation, right? You heard Dr. Bhatt mention about if there are like 6, 7 different point solutions, then there's only so much aggregation that can happen at a provider level. And sometimes it can adversely affect patients' journey or patients' care because now the data is segregated across the systems. So I feel that the next wave of digital health, as it brings, would kind of start looking at that aggregation with the service component a bit more acutely, because only if we do so, we will be able to really manifest the goal of like a better experience and a better continuous experience for the patient. So picking up on behavioral health, just because we were talking, I think so much phenomenal work happened in the last 3 years in that space. So many amazing companies came to the forefront, both in the D2C market, the B2B2C market. But I think the next layer has to create like an infrastructure that kind of like brings some level of aggregation into that. Otherwise, it becomes really, really hard for a provider to continue to be a part of a patient journey, and for a patient also to ensure that they just not split across 20 other systems. So that's my hope for the digital health, that the technology will keep making us more efficient, but the technology will now also start bringing more of a service lens and a workflow lens so that we can come at it from a patient perspective, from a patient experience perspective.
Well, thank you, Anu. I appreciate it very much. It's wonderful to talk to you. And thank you for your time today. I'll turn it over to Jerry to start the next session. But thank you, Anu.
Thank you for having me, Bill and Jerry.
No, thank you, Bill, for moderating a very energetic discussion from Anu here. And thank you both so much for your time and providing that insight.